One of the most common things that I see a patient for is generalized hand pain, or a patient coming in with numbness and tingling that's new to them. Carpal tunnel syndrome is very common. It's one of the most common things I see. A patient has pain, numbness and tingling that wakes them up at night. Sometimes they have to get up and walk around and flick their hands to feel like they need to get blood back to their hands, when in actuality it's just compression of the nerve. The median nerve goes through a very small canal in the wrist and then goes out to the hand and supplies sensation to a portion of the hand. And it also supplies a lot of the muscles in the hand, and that's why it causes pain when that nerve gets pinched. The nerve gets pinched when the tendons, most commonly when the tendons around it get swollen. And that comes from age. It comes from how your body reacts to the things that you do. It can come from being pregnant. You get swollen hands. It's associated with diabetes. Once I can teach a patient and educate them on what's going on, the treatment options become clearer for us to make those decisions together. Patients finally come to see me with hand pain and hand problems when it wakes them from sleeping, when it interferes with their activities of daily living, when it interferes with their sport, when they can't do things, or when they drop things, when ladies have trouble putting on their makeup, drying their hair because their hand goes numb and they have to stop doing what they're doing and start up again later. That's when people come to see me. One of the first things I do, if they've come with no diagnostic studies and just come with the symptoms that have been going on either a month or 6 months or a year or even multiple years, when I first meet them, the first and best thing to do for that patient is what I call a diagnostic and therapeutic carpal tunnel injection. That's a steroid injection into the carpal tunnel to help decrease the swelling around the tendons so the nerve has room to move around. If the patient has carpal tunnel syndrome, they will get better from that injection. They get better with respect to the numbness and tingling, and they'll also get better with respect to their pain. At that point, the patient and I decide together what the next step is for them. If that injection lasted 6 or 8 months, if they want an injection, we can do that. Injections are not the cure for carpal tunnel syndrome. Surgery is the cure. But if they can control it with a time splint or some injections, we'll do that. As long as I can keep that median nerve happy, then I'm glad for that. I think a blanket overall statement I would say to that is that I treat patients like I would want my family to be treated. I went to medical school a little bit later than most, after I'd already had children, and I have those life experiences, and even through medical school and residency I was able to put myself in the patient's shoes and treat them as I would want my family to be treated. And I still do that today, every day, every patient I see. I understand that they have to go back to work. I understand that they have children. I understand that going through surgery puts them at a disadvantage, having to have dressings on their hand or their upper extremity. And so we talk about those things, and we make sure that their life is as smooth as possible, dealing with any treatment options that we have to go through together.